Hello, welcome to Mednerd's. Today we're going to outline everything you need to know about the PLAB exam. That's the Professional and Linguistic Assessments Board test for doctors who want to practice in the UK. Whether you're in India or anywhere else, this guide will walk you through the entire journey. PLAB is the exam that international medical graduates must pass to demonstrate they have the knowledge and skills to practice medicine safely in the UK. It's administered by the General Medical Council, the GMC. Before you can even register for PLAB, you need to meet some essential requirements. First, English language proficiency. You must prove your English skills through either IELTS, academic with minimum score of 7.0 in each section and an overall score of 7.5, or OET, the Occupational English Test, with minimum grade of B in each section. Second, primary medical qualification. You must have a medical degree that's accepted by the World Directory of Medical Schools. Your primary qualification must be verifiable and legitimate. Third, clinical experience. While not strictly mandatory for PLAB 1, you'll need at least 12 months of clinical experience after graduation to get your GMC registration later. Fourth, EPIC verification. Your primary medical qualification must be verified through EPIC. That's the Electronic Portfolio of International Credentials. This is a must. PLAB 1 is a written exam that tests your knowledge. Here are the details. Format: 180 multiple choice questions, single best answer format, 3 hours duration. Content areas include common, important, or acute conditions seen in emergency departments, chronic conditions managed in primary care, conditions seen by doctors in wards, and health promotion and disease prevention. The syllabus is based on the UK Foundation Programme curriculum. It covers medicine, surgery, psychiatry, pediatrics, obstetrics and gynecology, and emergency medicine. The passing score varies, but typically ranges between 115 to 125 correct answers out of 180. It depends on the difficulty of that particular exam. You can take PLAB 1 in multiple countries, including India, major cities like Chennai, Mumbai, Delhi, Hyderabad, Bangalore, Calcutta, also UK, Egypt, Pakistan, Nigeria, and many others. Cost is currently around £247. Check GMC website for latest fees. Preparation time. Most candidates need 3 to 6 months of dedicated preparation. Once you pass PLAB 1, you move to PLAB 2. This is the practical clinical skills exam. Format: 16 clinical scenarios called stations. Each station lasts 8 minutes, plus 2 rest stations. Total exam time is approximately 3 hours and 20 minutes. Station types include simulated patient consultations for history taking, explaining diagnoses, breaking bad news, practical procedures like forecannulation, catheterization, suturing, clinical examinations including cardiovascular, respiratory, abdominal, neurological exams, and emergency scenarios like a CLS, managing acute emergencies. Location: PLAB 2 can only be taken in Manchester, UK at the GMC's Clinical Assessment Centre. Cost is currently around £906. Again, check current rates on GMC website. Passing: you need to meet the passing standard in both domains: data gathering, which includes history, examination, investigations, and clinical management, which includes diagnosis, treatment, and communication. Preparation: most candidates attend PLAB 2 academies or courses in the UK. Preparation typically takes 1 to 3 months. Now let me outline the step-by-step process specifically for doctors coming from India. Step 1. English test. Take IELTS or OET. Get the required scores. Results valid for 2 years. Step 2. Create GMC online account. Register on the GMC website. Start your application for registration. Step 3. EPIC verification. Create an EPIC account. Upload your MBBS degree. Get it verified by ECFMG. Step 4. Apply for PLAB 1. Book your exam slot. Choose your preferred location in India. Prepare and pass. Step 5. Apply for PLAB 2. Book your slot in Manchester. Apply for UK visa, standard visitor visa. Many Indian doctors join PLAB 2 preparation courses in Manchester. Pass PLAB 2. Step 6. Apply for GMC registration. Submit all documents. Prove your fitness to practice. Show good standing certificates from Medical Council of India. Pay the registration fee. Step 7. Get your license to practice. Once approved, you get GMC registration with a license to practice. You can now apply for jobs in the NHS. So you've passed both PLAB exams. Congratulations. What next? Job applications. Apply for non-training posts first, Phi-2 or CT1 level. Common starting positions are trust grade doctor, clinical fellow, or junior clinical fellow. Use NHS Jobs website, track.jobs, and hospital websites. Core training. After gaining UK experience, apply for core medical training or core surgical training. This is competitive. You'll need good CV, portfolio, and references. Specialty training. Progress to higher specialty training. Eventually become a consultant or GP, depending on your chosen path. Alternative routes. Some doctors also consider MRCP or MRCS exams for faster career progression, GP training, which takes 3 years, or CESR route for experienced doctors. Let me give you a realistic timeline and budget. Timeline. English test preparation takes 1 to 2 months. PLB1 preparation takes 3 to 6 months. PLB2 preparation takes 1 to 3 months. GMC registration process takes 2 to 4 months. Total, 12 to 24 months from start to GMC registration. Estimated costs in GBP. English test costs £150 to £350. PLAB1 costs £247. PLAB2 costs £906. UK visa costs £100 to £500. Flights to UK cost £400 to £800. Accommodation in UK costs £500 to £1,000 per month. PLAB2 course costs £500 to £1,500. GMC registration costs £156 to £630, depending on registration type. Total estimated £4,000 to £8,000, excluding living expenses during preparation. Here are some Mednerd tips for passing PLAB. For PLAB 1, use standard books like Plabable, 1,700 questions, and Samson Notes. Practice MCQs daily. Aim for 100 plus questions. Focus on UK guidelines, especially NICE guidelines. Join online study groups. For PLAB 2, practice communication skills. This is crucial. Record yourself doing histories. Join a good academy. They teach you the NHS way. Practice with friends or family as simulated patients. General tips. Start EPIC verification early. It takes time. Keep your medical knowledge updated. Understand NHS structure and ethics. Network with other IMGs who've succeeded. So that's your complete roadmap to the PLAB exam. Remember, thousands of Indian doctors have successfully made this journey. You can too. If you found this helpful, don't forget to like, subscribe, and hit that notification bell for more medical education content from Mednerd. Got questions? Drop them in the comments below. I read and respond to every single one. Until next time, keep learning, keep growing, and remember, medicine is a lifelong journey. This is Mednerd, signing off.